Hey everyone, it is Thursday night and it is another night of Back to Basics Live. I'm Dr. Vivian Asamoah. I am a gastroenterologist and functional medicine provider in Katy, Texas. And if you're on here, it is because you are part of our big family, the Natural Gut Relief Facebook group. This is a private Facebook group where we love to talk about everything natural related to food, gut healing, gut relief. We talk about everything that could be helpful to relieve our gut naturally. We talk about medications we shouldn't take. We talk about foods we want to eat. We talk about, we share recipes. We discuss a lot of things on natural gut relief, but I think what we try and do is bring facts, right? What we try and do is really combine the best of conventional medicine and integrative medicine. And I think that being a gastroenterologist, I can probably share a lot of that, especially because I'm so interested in everything that's nutrition and alternative medicine and functional medicine. So if you're on here, it's good to see you guys on. We're going to try and make this like short, but to the point. This is a very, very big topic. We talked about 5 hidden truths about GERD and learned a lot last week about reflux disease. And today I want to just talk about PPIs. PPIs are proton pump inhibitors. As a gastroenterologist, I prescribe a lot of those. I've tried to reduce prescription of PPIs, except where it's really necessary. But over the years, we have seen that patients are using PPIs more often, probably because you can get it over the counter. And sometimes it's a lot easier than actually changing lifestyle, right? So I want to talk a lot about PPIs today because there's a lot of information out there. And I think there's a lot of confusion. And I think even in the research world, there's a lot of confusion about what's real and what's not real. So we're going to go through a short PowerPoint presentation. And then I want to take questions. So if anyone has questions about PPIs, proton pump inhibitors, we'll talk about some natural solutions. And then I'll tell you guys about a virtual group that I'm putting together, that we have put together to help people who don't need to be on PPIs wean off PPIs. All right. It's going to be an interesting topic, guys. So if you are watching this on the replay, enjoy this. Send us questions because we will answer all the questions, even though you watch it later. I know a lot of people watch this on the weekends. So we're going to get started, and let me see if I can share my screen and we'll get going. All right. So hopefully you all can see my screen. Yay, excellent. So the 5 hidden truths about PPIs, we're going to dive right into that. And a lot of you are taking these medications, Nexium, omeprazole, Prilosec. This may ring a bell, right? This may ring a bell. So when you have reflux, we know classically what we need to get rid of, right? Spicy foods, mint and chocolate, trans fat, high fat foods, trigger foods, right? And very hot foods and liquids. And it does help to keep a journal. I'm going to check and make sure you guys can see me because it's really hard to see when you're on here. But I want to check. Yes, you can. Great. So it does help to keep a journal of what you're eating, right? And so generally avoid these foods. Now, it's interesting to note that there is an association between gluten and acid reflux, right? So sometimes if you're trying to identify what foods is causing acid reflux, the first thing to give up, along with all the other things we mentioned, but something that a lot of people don't think about, is gluten, which you can find in wheat, rye, barley, and triticale. So it's not uncommon for me as a gastroenterologist to, encounter patients who have reflux like GERD. And then I do some baseline workup because I'm trying to look for vitamin deficiency, and I'll do celiac studies and notice that they are celiac positive. And their only presentation was actually reflux disease, GERD. But we can see it not only in the celiac population, but we can also see it in people who just have gluten sensitivity or non-celiac gluten sensitivity and gluten allergy. So the problem with gluten is that when it gets into your system and it causes inflammation, it causes that permeability issue in the intestinal membrane known as leaky gut, and leaky gut in itself will give you acid reflux-like symptoms. So that is interesting. Gluten-free diets help. Paleo diet helps. The Whole30 diet helps. So you want to stay away. You want to go mostly with vegetables and protein. Stay away from grains. And we'll discuss this in a little bit more detail. So the classic things I want you guys to remember when it comes to reflux is that lifestyle makes a huge difference, right? The medications help to a certain extent, but lifestyle reverses acid reflux, they say, in about 70% of patients. So that's a ton. Imagine 70% of patients who don't actually need to be on the PPI, the proton pump inhibitor, and can actually just change their lifestyle and see if that helps. Things like alcohol, smoking, nicotine, caffeine, mint lowers that sphincter in the lower esophageal sphincter, and you reflux all the time and will cause acid reflux. So you want to minimize those things, just like gluten we said, and just like the spicy foods we mentioned. When it comes to what to eat, I think that's what, doctors are really good about saying, stay away from tomatoes, spicy foods, and, carbonated beverages, the classic things. But it's really interesting to note that the way you combine your foods can actually even affect reflux symptoms. So if you're eating a ton of carbs and a lot of fat, like you just go through a splurge where you're just overindulging and you're not watching anything, that can cause reflux. So grains, excessive carbs, excessive sugars, excessive processed foods, high fat foods, all of those will relax that lower esophageal sphincter and reduce gastric motility, especially high fat will really reduce gastric motility. So again, you want to go more for like a paleo diet or a Mediterranean diet, right? Just in terms of treatment. We talked about stress last time, guys, in terms of stress contributing to acid reflux, actually having such a huge role in terms of reflux, in terms of the way motility works, in terms of the gut-brain axis. So part of the treatment when it comes to lifestyle is cutting back stress, just finding ways to relieve the stress at least, right? So deep breathing exercises help. Diaphragmatic breathing, yoga, breath counting, the 4-7-8 technique, all of those things help. Acupuncture has been shown and compared head to head with PPIs. And actually, acupuncture relieves reflux way better than PPIs do. So there are other methods we can use rather than just taking a pill, right? Okay, so we've all heard of natural things we can do along with lifestyle. Apple cider vinegar, for those in whom it works, 1 tablespoon of raw apple cider vinegar mixed with 4 ounces of purified water before each meal rebalances that pH in the stomach. Organic baking soda, healthful, mix a spoonful in a glass of water, stir, drink before it stops fizzing. Aloe vera calms down the stomach, reduces the inflammation. So these are some natural things you can try. Some people do really well with apple cider vinegar, some don't. So try the other alternatives and see if you need something more soothing. When we go through our weaning protocol, we generally will replace the PPI with other things that will enhance the digestion, right? Bring in good gastric juices, bring in good bile juices. So we use digestive enzymes, we use probiotics. We encourage our patients to drink a lot of natural teas like chamomile, papaya, ginger. We use magnesium because a lot of patients are deficient, and we'll talk about that. And we use L-glutamine because it's known to heal the lining of the stomach. So if you want a good protocol, step-by-step guide to weaning off PPIs, because you've been on it for so many years, join our program. Now, we'll put the link in. It's a 4-week program. I'll talk about it in more detail. So you can just take a pill. Yes, you can, right? The antacids like Tums and Gaviscon and Alka-Seltzer can neutralize the stomach acid, but they don't prevent new acids from forming. So there's no long-lasting relief. It helps while the acid has been formed. But the acid blocker medication, the top of the line, guys, are the proton pump inhibitors, and they inhibit acids by suppressing its natural secretion. So guys, when you start suppressing anything that's natural, right, that should naturally be there, it's a problem. And so we're going to talk about the 5 hidden truths. I did some research because we're hearing a lot of things and we don't know how much truth is in that. So I looked at a study that has looked at all the different studies and kind of looked at whether the evidence is strong or weak. And when we talk about these side effects in terms of PPIs, we want to talk about people who have been using them for at least, I would say, a year, right? A year or more, and using them at higher dose. But it's the chronic use that's the issue. So hidden truth number 1, low stomach acid causes something called hypochlorhydria. PPIs, cause something called hypochlorhydria. That is low stomach acid. Your stomach acid should be your stomach gastric juices should be between 0 and 4. Why? Because you need acid to churn the food, digest the food, break it down, make it into that chyme that we call it, right? And it also helps break down the macronutrients, the protein bits. It activates digestive enzymes so the enzymes can work well. And what it does, really a big part of what stomach acid does for us is when we lick our fingers or we swallow saliva, there's always bacteria in our mouth on stuff we're eating or foods that maybe are not that great and we're eating it like it's slightly perished and we eat those foods. This acid in our stomach eradicates and kills the bacteria. So when you use an acid blocker medication, the acidity goes away. So we'll notice that our patients move from a normal acid pH of 0 to 3 or 4 to like 4 to 6. So there's no acid there. It's not doing its job. So bacteria have a field day. This is hidden truth number 1. People who use acid reflux for a long time at prescription dose, even over-the-counter dose, but chronically months to years, have an increased risk of developing C. difficile infection, which is a nasty colitis in the gut. People die from that kind of colitis. Are going to be higher risk of developing Salmonella, Shigella, Campylobacter, gastroenteritis. So every time there's a recall that the salad from Kroger was off and it had Salmonella, if you're on a PPI, you're going to be more prone to getting that infection than someone who's not taking an acid blocker medication, a PPI. And finally, small intestinal bacterial overgrowth. And we talked about this one in Back to Basics, maybe 2 Back to Basics ago. And small intestinal bacterial overgrowth is so important because it leads to leaky gut and causes a lot of systemic issues, right? There is strong evidence in the scientific literature to support that low stomach acid increases your risk of all these infections. There is less risk with pneumonia, like less data with pneumonia, but all the top 3, there's strong evidence to support this. So this is definitely a fact. Hidden truth number 2, low stomach acid does not allow calcium to be absorbed because calcium needs to be absorbed in an acidic milieu in the stomach. And so without acid, less calcium, and we talk about the risk of bone fracture. So we see this on a lot of commercials for Nexium and all those other medications. Be careful about the risk of, hip fracture. Now, the studies show that the risk is there, the association is there, probably not as strong as we think it is. There are probably other factors that contribute a lot more to this bone fracture risk, but the risk is still there, although the data is weak. So if you've got already a family history of weak bones like osteoporosis or osteopenia, or you chronically use steroids, or you chronically use other medications that weaken the bone, or your vitamin D is low, like most of us, right? Taking a PPI on top of this is most definitely going to reduce your absorption of calcium and increase your risk of bone fracture, right? Micronutrient deficiency. This is similar to, when we talk about that, we're kind of talking about vitamins and trace elements. This is similar to the whole notion in terms of calcium. B12 needs to be absorbed in an acidic environment, right? That's how we cleave B12. That's how we get B12 from food. It has to be done under an acidic environment. So the studies are showing that this is in fact true. The data is I would say moderate to support it, right? There are enough studies that are showing this. We see it clinically in patients who have been using B12 for a long time. So they're saying after 2 years of consistent use of PPI, we may start noticing B12 lower in some patients. This may even be more significant for our patients who have like MTHFR deficiency. So very careful with PPI use. Definitely low magnesium. And magnesium helps everything move in the body, nerves, muscle, everything. It reduces, it reduces headaches, migraines. We use magnesium for gut motility, everything. And you'll notice that some of the PPIs now, like omeprazole, they make the manufacturers make omeprazole with magnesium, because they actually noticed that when they didn't add magnesium, so many people became deficient that they started having shakes, muscle twitching, irregular, like eye dropping, eye movements related to low magnesium. So I think, they've probably done the studies in their labs and they know the evidence behind it. So now they actually make the omeprazole with a magnesium supplement. It still doesn't mean you're going to absorb it, but they're just giving you more. So if you are on a PPI, you probably should be taking magnesium, or you need to get off the PPI if you don't need it. There's some data on poor iron absorption, but that data is not as strong as vitamin B12 deficiency and low magnesium. Now, they say you don't, in the studies, they say you don't necessarily need to be checking B12 on a regular basis. But if you're deficient, if there's a likelihood that you're going to be deficient, your PCP or your gastroenterologist or whoever's prescribing the PPI should at least check it once a year. Or, because you don't want to wait until you now have side effects from B12 deficiency, which can include depression, anxiety, a neuropathy, anemia. You don't want to have to wait to have those side effects before you actually treat it. Hidden truth number 4. This is controversial. There's a school of thought that believes that every time you give someone a PPI, you suppress the cells that release acid. And there's a feedback mechanism that stimulates other cells that release gastrin, so it can continue to stimulate the cells to release acid. So it's almost like your body is fighting back against the PPI. And whenever you stimulate cells, it causes cell proliferation. So the cells go bigger. And that's why in a lot of patients who take PPIs, we see gastric polyps. We see polyps, like 20 polyps everywhere when we do endoscopy. It's because of the body trying to reverse this unnatural medication, right? This artificial medication. And so there's some people who believe that it's possible that these chronic use of PPI may increase the risk of stomach cancer. And I was very surprised to read in the studies today that this had been previously disputed, but about 5 years ago, we're seeing more and more data actually supporting the fact that PPI, chronic use of PPI, may increase the risk of stomach cancer. So they're saying we need to do more studies to really hone in on this. But if there's any inkling towards that, if the data is really leaning in that direction, then you have to evaluate whether you need to be on this medication chronically. And you have to have a conversation with your gastroenterologist or your primary care doctor. Hidden truth number 5. So, there are tons of hidden truths, right? But I really picked the top 5 for which I found the most supportive data, right? Supportive research to back it up. Acute kidney disease and chronic kidney disease. Yes, PPIs can affect the kidneys. This is definitely pretty strong data. And that's why we see nephrologists actually stopping PPIs because it can actually just cause an injury, toxic injury to the kidneys, cause them to fail acutely, and eventually lead to chronic kidney disease. So if you have a family history of kidney disease, if you yourself suffer from, that your creatinine is sometimes high and your doctors keep saying, oh, we got to watch that kidney, we got to watch that kidney, please do not commit to a PPI chronically. If there's any way else to resolve the reflux, then that's what we should be looking into. So I didn't include this one as a hidden truth 6 because this one is still quite controversial. Alzheimer's dementia, right? We believe that there's a protein called the amyloid beta that accumulates in the brain in patients with Alzheimer's disease. And that protein is broken down by acidic lysosomes, which are acidified by proton pumps. So the lysosomes of patients taking PPIs may be less acidic, and so they're less able to break down the protein, which leads to an accumulation in the brain. Remember, proton pump inhibitor is not only working in your stomach, it's working wherever there is proton pump, which is throughout the body. So there are 4 studies in the last decade that suggest possibly yes. They say that these studies were not done correctly. So the evidence, we can't really conclude anything from that. But I was interested to discover a study from Taiwan where they looked at 15,000 patients who took PPIs and who developed Alzheimer's dementia, and there was an association. So that's probably one of the strongest studies we have. Of course, right now, they're not saying it does not lead to PPI, dementia development, but they're saying maybe we need more studies to really prove that it leads to dementia. Two different things. The association has not been nullified, but it hasn't completely been confirmed, and there's a lot of data suggesting that it can. So I don't know if we all want to wait until the data comes out, but I'm not sure that that's safe if you can change diet and lifestyle and not have this issue. This is what I posted on our Natural Gut Relief page. You guys will see all the different possible side effects, adverse effects of PPIs that we've discussed. Some of them are valid, like these. Some of them, not a lot of evidence. Some of them, yes, we do have a lot of evidence. I think for me, the biggest one is small intestinal bacterial overgrowth, simply because of what we know it can lead to in terms of systemic issues, right? Okay, and that is what I have. I'm going to see if you guys have any questions for me at all. All right. Thanks for hanging out with me, guys. We talked about the 5 hidden truths of PPIs. So if you are on a PPI and you've been on a PPI for a long time, and it's possible you have that NERD entity, the one where when we scope you, we don't actually see erosions or inflammation. When we take biopsies, we don't see much. Everything looks good. If you haven't tried to change lifestyle and diet and get resolution of symptoms, that's a must. 70% improvement in lifestyle and diet changes. We talked about aloe vera. We talked about apple cider vinegar. Helpful for some, not helpful for all. And we talked about, what was the last one? Baking soda. We talked about weaning protocols that include digestive enzymes, probiotics, putting acid back into the stomach. We do that. We put betaine HCl. We give our patients betaine HCl to see if it can reverse the issue. And remember, not all reflux is because of acid. We talked about this, right? Go back and watch Back to Basics 1. Not all reflux is acid related. So you want to really see what the cause is. And you want to talk to your doctor. You want to talk to your prescribing gastroenterologist or physician and ask them, risk of stomach infections, right? Micronutrient deficiency, vitamin B12, magnesium, bone loss, risk of bone fracture. You want to talk about the impact of PPIs on your kidneys, right? And what was the last one? I'm forgetting. There was one more. Let me see. So many. Actually, we talked about Alzheimer's, but we didn't put that into the pool. But all of these things can cause issues. We talked about B12 deficiency, yes, and magnesium, hypomagnesium because of PPIs. All of these things must be addressed. And so when you use this chronically, it's a problem. Try and really reduce the trigger foods that are causing issues, because we've been using PPIs now for, I would say, a good, 15, 20 years, maybe a little more. And we are now publishing the data and we are now seeing the issues, right? And so I feel like in 10 years, the studies are even going to be probably more conclusive, and we're going to find even more issues. So if you can get off your PPI, get off your PPI. And if you need help to do so, connect with a gastroenterology team or a PCP who can help you do so. Join our Wean Off PPI protocol, and I will post it on. However, as a gastroenterologist, I will say, and here again, we go about combining the best of both worlds, right? Conventional and functional medicine. If you need there are some patients who need a proton pump inhibitor. They have Barrett's esophagus, right? High risk for esophageal cancer. They have a hiatal hernia, may need surgery. They are high acid producers. There are not a lot of those patients, right? They have erosions and ulcers in the food pipe. They have ulcers in the stomach. There are not a lot of those patients, but if you need a PPI, please do not discontinue. Do not wean off on your own. Get the guidance that you need so you do it right. And in some patients, they've been on PPIs for like 20 years and eventually come to see me. We do all the necessary tests, pH testing, manometry testing. We'll check for motility, we'll check for H. pylori, and we'll see a huge hernia, and I'll send them off for surgery, and they're better. They're better, and they don't need to go back on their PPIs. So think about it, guys. If you're on a PPI, this is a medication that looks safe, but very problematic. So I posted the PPI reversal group. It's a private Facebook group. So interesting as a physician to go on there and watch how PPIs have really affected people's day-to-day lives. People are struggling to wean off the medication. They share a lot of great information, a lot of great videos, a lot of great tips about how they have struggled as individuals to get off these medications. So think about it. If your doctor has prescribed a medication and you can't get off it, and it's such a struggle to get off the medications, you're having so many side effects on the medications, you can't get off the medications, it's not something you're supposed to be on chronically. So ultimately, the goal is use it for as little time as you need it, wean yourself off it quickly, and focus on diet and lifestyle. Thank you guys for joining me. It's nice to see you guys all on board. If you're watching this on the replay, enjoy it. Send questions. I'd love to answer all your questions. And if you know someone who needs to wean off PPI, I'll be posting the link for our 4-week program. Go ahead and sign up. Have a wonderful Thursday, and we'll talk next week. Bye-bye.